Hello everyone, I'm Vijay from 21D, and today we're going to talk about a very vast subject, but I'm going to give you a brief overview of how we make our medical devices. Okay? Our medical devices, our prosthetics, are the things that we put into our patients to replace the teeth that they have lost, and they are prosthetics. They are pieces of medical engineering that are calculated, designed, and made to a very high standard by the likes of the machines that you see behind me over there. These are all very high precision milling machines and 3D printers specifically designed for use in the medical sector because we know what tolerances everything needs to be for it to work in the body. So as you go through the journey, you will interact with different medical devices we use. So for example, at the beginning of the process, when you have the surgical correction, you will have specifically made 3D printed guides, which will guide your implants to the perfect positions that we planned them to, so we don't have to guess whether they're in the right place. We know that they're in exactly the place that we planned them to be. We then fit on top of it something called a deprogrammer. It's often referred to as temporaries in other clinics. We don't call it a temporary for a reason, because it actually has a very specific job. Its job is to deprogram your jaw joint and put it into the correct place that we want it to be for the long term. It will have bite engineered into it exactly where we need it to be while you're healing. Then after that, at the end, we will fit your LTP, which stands for long-term prostheses. Again, we don't call them finals for a reason. It is a long-term medical device, and that is the correct wording for this process. So in these boxes, I've got the different devices, so I'll just run through some of them with you. So this, for example, is one of our surgical guides. It usually comes in two parts, and they're highly precise, and they're custom made for every single patient. For that patient, it will only go in one way. So there's no chance that it's ever fitted incorrectly. It either goes in perfectly or it doesn't fit at all. This helps us make sure that the implants are positioned in your skull, in the jawbone, in either the upper or the lower jaw, exactly where we planned it. This is really important because the very precise placement of the implants themselves determines the long-term performance of the implants and the prosthetics in relation to the actual jawbones of the individual person. So this guarantees that the implants go exactly to where we planned them to go. Once we've finished putting the implants in, these are what we call deprogrammers. These are the first set of prosthetics, and they are screwed directly onto the implants, and they are fixed and you cannot take them out. And as you can see, there is no pallet. You can't remove these, and you literally just brush them very simply. And they're designed to work like that. Okay? So you will probably, in most instances, leave with a lot more teeth than what you came in with. Okay? These are made out of discs like this. This is medical grade PMMA. There's a lot of misunderstanding, and a lot of people use words like plastics. These are no ordinary plastics. These are medical grade polymers that are specifically designed to function in the human body. And as you can see, it comes in a disc form like this, which means the shape, if you look across over there, one of my clinical designers is currently designing the outline shape for a person. And as you can see, it's a very detailed process that he is going through to make sure that it is anatomically designed in the correct way to accommodate all the anatomical structures around the teeth, like the tongue behind, the lip in front, all kinds. Once we have that shape, what we do is we take that file and we put it into that machine, and we put the relevant disc depending on the shade that was chosen. So if a patient picked an A1 shade, we'd take an A1 disc. If a patient picked a B1 shade, we'd take a B1 disc. You'd put it into that machine, and these machines, over a period of about 3.5 hours per jaw, will cut the shape. At that point, this product is about 95% done. All the critical areas of the product, which is how it fits to the implants and the bite itself, is already engineered in by the machine. And there's very little hand manipulation by a human being other than polishing it up and adding a little bit of detail. And that's it. And these are the devices that we use on the day of surgery, and we have these ready before you have surgery. So actually, immediately after the implants are put in, we fix the teeth immediately, so you have no downtime where you're waiting to have the teeth made or any of that stuff. It's instant. Okay, so it makes the whole process much simpler for a patient, which means theoretically, most patients who need 2 jaw corrections can come in at 9 o'clock in the morning, and by about 12:30, they can be heading home with fixed teeth in the mouth. It's really that straightforward. So this is the process and the devices that we use on surgery day. Then we've got the devices that we use as your long-term prosthetic. So I'm going to be making another video where we talk about why 21D does not use things that lots of other companies talk about, for example, zirconia or ceramics. And we make ours out of titanium PMMA. And as you can see, the fitting side, the bit that fits the gum area, is a very highly polished metal. This is the most hygienic surface you can put against gum tissue. Nothing is more hygienic than that. And the other part, which is called the veneer, which is this bit, the tooth part, and imagine that your lip sits there. As far as the rest of the world is concerned, that's your so-called teeth and your smile. But it is actually a medical device, and it's designed in a way where, as you can see, there are screw holes, and we screw them onto the implant itself. If everything's been done properly, it should take, at best, 5 to 10 minutes to fit one of these. They're that accurate, okay? And they're designed to support the lips, to give adequate room and space for the tongue. But again, people, this is something very new compared to what they walked in with 12 weeks earlier. They have to adapt. That adaptation process for almost all human beings can take up to 2 years. But the wording is very important. Some people adapt in a week. Some people adapt in a month. Some people adapt in 6 months. Some people can take up to 2 years. I've never had a single person who's never managed to adapt in over 20 years of doing this. So I know that people will adapt. What I cannot predict, what no clinician in the world can predict, is how long it takes somebody to adapt. It's a bit like having a replacement hip. If you had a replacement hip, some people are fine with it much sooner than others. Other people struggle to adapt. It's only because of the compensation of all the other muscles around these devices that need to adapt to a new reality, which is a prosthetic state. We are not growing new teeth, and the materials we use are very specific, because one of the things that we want for our patients is fail-safes, and we want shock absorbers. We know that we can't use things that are ridiculously hard because the damage will just transfer somewhere else. And we know we can't use things that are ridiculously soft because they won't be robust enough to eat a normal human diet. So we need to find that happy balance. And in my career, definitely for the last 10 years, since the advent of these new materials, this is what we have used. PMMA as a material has been around for about 80 years. But the very fact that they come in a very highly processed, much, much stronger pre-processed form in discs, and being able to be cut out of milling machines that work to an accuracy of 10 microns has been a massive game changer in this arena, in the ability to produce something of such high engineering standards. Thank you.